So our next guest, I'm very, very, very excited to have Dr. Belisa Vranich, and she is a psychologist, but she also is an author, and she has something really amazing to say because she, you know, uses breathing techniques to enforce mental strength, and she's all about this mental support and fitness and wellness. So welcome, Dr. Belisa Vranich. I'm really excited to chat with you. She's also gonna. Oh, never mind.
Hi, how are you?
Good.
It's nice to see you.
Welcome.
I have my mask and I have it on, even though you can't tell because it actually blends in really well. So it is on,
nice.
though. It is.
Especially when the skin is a little dehydrated, the mask goes in right away and it gets absorbed, and it's so nice. It really hydrates our skin, especially when we spend so much time in front of the screens right now. So I'm so happy to have you because I know we're also going to do a breathing exercise. But first of all, I want to talk to you about something which I've been thinking a lot about as well. There's actually a silent pandemic that comes with the corona pandemic that is that it's about mental health distress. And this is also a pandemic. Lots of people suffering of this mental health distress. And how important is breathing here?
Well, breathing is tremendously important because it is the mind-body connection. So when you talk about emotional well-being and mental health, and even inflammation and immunity, you have to take into consideration your state of being, and that's always dictated by how you're breathing. So your brain and your nervous system looks to see how you're breathing, to see how it should be feeling. And most of us right now are not breathing well. We're not taking deep, wonderful, healthy breaths. We're taking short, shallow, scared ones, and it is affecting the way we feel, and it is affecting our bodies and our minds.
That's a really important topic. Also, I think, you know, a deep and valuable breath also ventilates our lungs, which is also super important in order to stay healthy, get our blood oxygenized. And I think that's really, really something we should be working on. And how can we do that?
Well, you brought up something that's terrifically important, which is that good ventilation is going to be good for your immune system when you're not sick, when you're just trying to stay healthy and you're trying to optimize. So the idea that you should be doing breathing if you've already gotten COVID is very, very important. Obviously, you have to keep ventilating, even if it's uncomfortable, but working on your respiratory system, having strong lungs is something that we should put very high up on the list, along with, as Dr. Jake said, good nutrition and exercise. But our respiratory system can be strengthened. It does control our arousal, meaning it can calm us and help us with stress, but it also has a very, very physical component in that we need to stay well ventilated. Our oxygen needs to stay well balanced as far as carbon dioxide and oxygen. So that ventilating, good ventilating, is important to do all the time, regardless of what's going on in the world and with your health.
So how do we do this? You show us an exercise now, yeah?
Sure. Okay, I will. So what I need you to do first is take your hands and put them on your body. So I want your hands, you spread out your 5 fingers and put them on the middle of your body, and your thumbs should be on your ribs and the other 4 fingers on your belly. And I want you to start with the exhale. So when you exhale, I want you to tip your body back and think about your belly button getting closer to your spine. Exhale all the way out and squeeze, even use your ab muscles. Now inhale and tilt forwards and think about expanding, but no shoulders. So take your shoulders, roll them out. They don't have anything to do with this. Shoulders aren't breathing muscles. And continue that way, where you tip back, your hips go under you, you squeeze your belly and try to narrow your body. Then on the inhale, you tip forwards and you press your belly into your hands. And if you do this, tipping forwards and back, it's more of a diaphragmatic breath. And this is a breath where your nervous system hears for you to calm down, and you're able to slow down your breath. So just doing this a minute every couple hours with your eyes closed and listening to your breath coming in and out of your body is going to take you and reboot you and give you that reset that you need to be able to calm down and then keep going.
This is amazing. So let's all do this throughout the day from now on. I think it's a very great advice. Thank you so much for being here with us. This was really helpful, and can't wait to hear more from you.
Thank you for doing this. It's been fantastic.